let's just chat first about how do we prep the patient to get them paced. And so obviously you want to place these pads on clean skin. Ideally, if you had time, you would clip the hair, but let's be honest, we usually have time when we're doing this. So I will be I will admit something I'm not totally proud of, but I've done wax on, wax off with a set of pads. So I have been in situations where you're just like, this patient needs such emergent pacing that we'll put a pair of pads on, rip them off to get the hair out, and then place a new set of pads. I mean, that's not ideal, but in an emergent situation, it's what you can do. But I can't say enough, like the skin has got to be dry under those pads. If the skin isn't dry, you may need to replace the pads. And unfortunately, sometimes these patients are really sweaty, when they're so bradycardic and they're symptomatic with their bradycardia. The other thing you have to remember is you have to place the ECG electrodes from whatever defibrillator you're using to pace the patient. This is a must. So the patient's likely going to have the ECG electrodes from your bedside monitor. Then they're going to have a second set of electrodes from the defibrillator. And then they're going to have the defib or pacing pads on either anterolateral or anterior posterior. So it's a lot of real estate that's taken up on the chest wall, but you can't pace unless you've got those ECG electrodes. And I'll kind of correct and amend that statement of you can't pace in just a second, but you need to have the ECG electrodes from your defibrillator. If you see like a little incision in the patient's usually upper left, or if you see like a generator, a permanent pacing generator bulging out, you need to make sure the pads are placed at least 1 to 2 inches away from a permanent pacer. And you might be like, well, why would we be doing this if they have a permanent pacer? When the battery starts to die, that's when you need to place this. So something to kind of keep in mind as well. And then, if the patient is continuously pacing, most manufacturers will say that you need to change the pads every 12 hours with continuous pacing. I would say just know what your hospital policy is. I know if we're not actively pacing, like let's say we just got the pads on standby, it's usually every 24 hours you change the pads. But if you're continuously pacing, 12 hours is supposedly the kind of maximum amount of time you'd want to use those pads. I'll just say though, if you're continuously pacing, it's kind of scary because you need the pads. So, but I mean, I cannot remember a patient I've ever had that we've continuously transcutaneous paced for 12 hours. We are almost always putting in a transvenous pacing wire in that case. So, but those are a lot of the manufacturer recommendations.